Is it possible to inject yourself with insulin without feeling pain? Yes, it is. And in this video, we are going to look at some of the ways to achieve this. Hello, our dear viewers. I'm your physician, Dr. Andrew, once again, and you're welcome to our YouTube platform, Health Tips and Tricks. If you are new to this channel, kindly subscribe. And if you've missed our previous videos, feel free to visit our site and view them in order to learn more about your health. So in this video, we are going to look at how diabetes patients can inject themselves with insulin without feeling pain. And we are going to divide this into three. One, we are going to look at the site of injection. We are going to look at the type of needle you're using to inject yourself with the insulin. And then three, we're also going to look at the technique. So we shall look at the needle first. So the old needles used to be big. The old needles which used to use for injecting ourselves with insulin used to be big. And these would cause certain amount of pain. But with advancement in technology, we now have newer needles that are very small, and these are almost painless. I will show you an example. So here with me is an insulin pen, which is one of the ways in which to deliver insulin drug to the body. And here, if I open it like this is our insulin, which is the drug. The needle comes in a small pack like this, and it is inside. Very small needle, which you can't even be able to see. So I just tie that to my pen and fasten it there. Then I pull this off and pull this off. So this is how small the needle is, and as you can see, it is quite very small. And if you pierce yourself with this, you almost feel no pain. So with these newer needles, a diabetes patient will be able to inject themselves with insulin without feeling pain. So that's one way. The other way is the technique of injecting. So for example, if you inject yourself using the wrong technique, then the needle will feel painful. Here I'm just going to demonstrate and show you. This needle, the pen, you have to hold it like this. And as you're injecting yourself the insulin, you have to go to the body and enter your body at 90 degrees and push it in until it enters all the way. Then you can deliver your drug. And if you use this technique, this will be not painful. The old techniques of tilting the needle, those ones will cause some pain, and they are discouraged. That is number two. Number three is the site of injection. So to demonstrate that, I'm going to use this small diagram here, which is a diagram of a patient who has diabetes. And there are several sites for injection, but the best site which has enough subcutaneous tissue which you can use to inject yourself without feeling much pain is the abdomen site, the site which is here in your belly, on your lower belly. So this site is the best site for injecting. And why is it good? Because today you can inject at one spot, tomorrow you change to another spot, the other day you change to another spot, change to another spot, so that by the time you come back, these spots have all healed, and you prevent the issue of injecting in one site several times, which can cause pain. And you can even go up and come and come and come, and by the time you come around, you find this site has healed, so you will not get any pain. So this is another way in which you can inject and have little or no pain at all. So in summary, we have looked at three ways in which you can reduce pain at the insulin injection site. One, using the newer pens which have quite very small needles. Two, the technique of injection, holding the pen like this and entering at 90 degrees. And then three, the site of injection which is least painful, and that is your belly or the lower belly, because it gives you a chance to move around and inject several sites so that you don't have to inject one site several times, which can cause pain. I hope this was helpful. Thank you very much. I remain your physician, Dr. Andrew.